Jasneet, in your experience as an elder care physician, if someone is concerned about their memory loss or someone else's, what is the process they need to go through to look into a diagnosis of dementia?
Now, how we go about diagnosing the condition is we start off with interviewing the person who's suffering from the memory loss, and we explore basically their cognitive function. The assessment usually includes an interview of the care partner, and that is where we get our historical information from. And it also includes a mental status examination of the person who's suffering from the memory loss. The mental status examination is our way of trying to uncover if there are cognitive changes in the person who's presented with the problem of memory loss. They can be structured. You may have heard of a very common form of mental status examination called the mini mental status examination. And what it is it's a series of questions that explore memory, orientation, recall, language, etc. And it results in a certain score. And that helps us determine if there is cognitive impairment in the person or not.
So is most of the assessment question and answer examinations, or are there medical tests as well, such as MRI or CAT scans?
So after we have obtained the relevant history, usually from a care partner, and we have conducted the mental status examination of the person who has presented with the memory loss, we usually will do a physical examination, and following that, depending on the history and the findings on the physical examination, we may do some laboratory tests and x-rays. They're quite simple. For the common types of dementia, there aren't too many tests that are actually needing to be done. And as far as x-rays are concerned, the one consideration usually that's made with every patient with dementia is if a CAT scan or an MRI is warranted, and that's of the brain.
Is it important to see your doctor right away if you're concerned about a memory loss?
It is very important to see a doctor when somebody is believed to be suffering from memory loss. The doctor can help determine if it is dementia or not. And that diagnosis of dementia, the early diagnosis of dementia, is very important, not just for the person who's suffering from memory loss, but also for their care partners and rest of their family. The understanding of dementia leads to much better care for the person suffering from dementia as well as the care partners. There's a lot of issues that can arise from dementia that need to be understood. And there are lots of planning that needs to go into place. Dementia is a prolonged illness. And the person suffering from dementia, along with their partners in care, need to understand that journey and need to understand what supports are available and how to cope.
Thank you so much for sharing this with us today. I hope this has helped answer some of your questions too.